Good afternoon. This is Jacob Livingston. I want to start by saying thank you to Dr. Chapman for the previous video. It was very insightful and I was glad to hear his expertise. So thank you, Dr. Chapman. I completely agree with everything he had to say. He talked a lot about the disparities in healthcare, but I want to focus mainly on patient care outside of the hospital setting. Dr. Chapman talked about how we focus a lot on the hospitals in the United States. We do a lot of research, we pay a lot of money, and yet our outcomes still are not good. So I want to focus on what the patients can do and what solutions can be presented to patients outside of the hospital setting. So Dr. Chapman talked about things like high obesity rates, inactivity, diabetes, heart disease, all these things that can be tracked and monitored outside of a hospital setting, and if done correctly could potentially prevent these chronic diseases from happening altogether. So Dr. Chapman talks about changing our social behaviors on obesity, inactivity, and substance abuse. So let's talk about that a little bit. Our book that we use in class is called Clinical Data as the Basic Staple of Health Learning. And the chapter we just read about talks about longitudinal data. And longitudinal data focuses on a wide range of data well outside the hospital. Things like your natural environment, your cultural context, political context, biological characteristics, social attributes, just to name a few. And the hospital really only fits into a few of those categories. So focusing on longitudinal data, trying to gather data from people's houses, the gym that they go to, work, monitoring their heart rate, their cholesterol levels on a daily basis rather than when it's too late. To try and create that preventative care atmosphere in our society. So that really kind of lends itself to learning more about people outside of the hospital. An article that we were presented with called The Impact of Social and Cultural Environment on Health talks about how there are so many factors that go into a patient's health. Things like genetic inheritance, personal behavior, access to quality health care, and general external environment, such as the quality of air, water, their houses, everything. So there's an enormous amount of factors that go into health, and it's a huge problem to face and to tackle. But I think with data-driven solutions, we can create a better health system. This article talks about how social scientists and social epidemiologists have turned their attention to a growing range of social and cultural variables as antecedents of health. So if we can change those social and cultural variables and change the society around it. So an example Dr. Chapman used was smoking. We put a negative connotation on smoking in the United States, and I believe that was a huge part of getting the smoking rate lower than many places in Europe. So if we can do the same for obesity and inactivity, I think we could grow and create better health outcomes in the United States. Another article that I found was one called Mobile Health Technology Evaluation, the mHealth Evidence Workshop. And what this article tried to do was do a workshop to evaluate something they called mHealth, or mobile health. So something that takes mobile devices, so you can take them to your work, your home, if they're students when they go to school, just with you throughout the day to monitor your health outside of the hospital setting, while still, at the ease of the patient, nothing too invasive, but also very beneficial. So it talks about creative use of new mobile and wearable health information and sensing technologies. I think these could help link a person's lifestyle with population health data that could potentially help improve better outcomes. And that was the end result of this case study also. They did rigorous research that was needed to examine the potential as well as the challenges of utilizing mobile technology to improve health outcomes. They described current evaluation standards, discussed future possibilities, and set a grand goal for emerging field of the mHealth research. So they really take a broad approach to the research of this mHealth. And in the end, they saw that it had a lot of potential. And I think it does too. So using data-driven solutions, I feel like, is the future of the healthcare system. And I think it's something that can really help patients and just to improve the overall health outcomes, to try and prevent things like chronic illnesses before they ever happen. So thank you again, Dr. Chapman, and I look forward to meeting you in the future and also talking more with you. Have a great day.